Assalamualaikum. We are from Team 11. We'll be presenting on diseases related to the tongue. The slide was prepared by these 6 students. Here are the table of contents for our presentation. First, we will be talking about a case report of a tongue ulcer presented as the first sign of occult tuberculosis. A 57-year-old male patient came to the Department of Oral Medicine with the chief complaint of pain ulcer on tip of his tongue. The ulcer had developed 3 to 4 weeks ago without any triggering event. He had TB over 40 years ago but healed after pharmacological treatment. During intraoral examination, there was round ulcer approximately 0.7 cm in diameter. There were no lymph node and bone involvement. The complete blood count was within the normal limits. Serologic tests for HIV and hepatitis C were negative. The differential diagnoses for the time being were major aphthous ulcer, traumatic ulcer, granulomatous diseases, and infections. The left picture shows the ulcer. Topical mouthwash was prescribed for 7 weeks. Triamcinolone acetonide was given intravenously twice for 2 months. The patient was instructed to avoid any possible stimuli. The biopsy performed revealed granulomatous lesion. Ziehl-Neelsen staining demonstrated acid-fast bacilli, thus the definitive diagnosis was lingual tuberculosis. The ulcer almost disappeared after 2 months of drug therapy. The next 2 months, the culture showed no growth of Mycobacterium tuberculosis, and then the patient was followed up for 9 months without any complications. Once the patient referred to pneumologist, a chest computed tomography was taken. The result showed destructive findings with consolidation and fibrothorax in right lung, while formation of cavitary lesion with clustered centrilobular micronodules in apex of left lung. Diseases of tongue can be caused by systemic. The first one is associated with systemic diseases. The first disease is anemia. It is a condition in which the number of red blood cells is lower than normal. Usually the patient presents with mucosal palate. Crohn's disease and ulcerative colitis is a type of inflammatory bowel disease or IBD. Crohn's disease usually presents with cobblestone mucosa. However, gingivitis can be found in both ulcerative colitis and Crohn's disease. For HIV-associated ulcer, it is an infection that attacks the body's immune system, which is CD4. Usually, the clinical presentation is aphthous-like ulcer. This picture shows how the oral mucosa and tongue looks like when it is associated with the systemic diseases.
So next, I will present about the oral squamous cell carcinoma. It is a malignant epithelial plasm that arises from the lining mucosa of the oral cavity and is characterized by invasion of local structure and metastasis to regional lymph nodes, followed by to the other organ system. And the risk factor is tobacco, bacteria and other chewing habits, alcohol, immunosuppression, and also genetic predisposition. And for the causative agent is a human papilloma virus, Epstein-Barr virus, and Candida. For the clinical feature, for the site is a lateral border of tongue, floor of mouth, mandibular alveolus, buccal mucosa, and for the associated feature is a pain, ulceration, swelling, halitosis, lump in the neck, fatigue, and weight loss. For the clinical presentation as shown below. Next, for Addison disease, is a rare long-term endocrine disorder characterized by inadequate production of the steroid hormones, cortisol, and aldosterone, causing renal insufficiency, and it also associated with tuberculosis. For the symptom, the patient may have dysphagia, fatigue, weight loss, hypotension, abdominal pain, amenorrhea, nausea, vomiting, and also thin and brittle nail. It also clinically seen with hyperpigmentation due to ACTH melanogenosis and intraoral pigmentation over the gingival, vermilion border of the lip, buccal mucosa, and palate tongue as shown in the picture. And also it acts as evident and perceived as a first sign. Oral pigmentation develop more early than their dermatological counterpart.
So here is another disease which is related to the tongue, which is the herpes simplex virus, HSV. So herpes can appear in various parts of the body, which is commonly found on the genitals or the mouth. There are two types of HSV. First would be HSV type 1, which usually causes oral herpes and is responsible for cold sores and fever blisters surrounding the mouth, or it can also appear on the face. As for the second one, it is HSV type 2, which primarily causes genital herpes and is responsible for genital herpes outbreaks. The pictures on the right display as an example of HSV type 1. So the sores that are due to herpes simplex virus will first occur as fluid-filled blisters that would rupture after a day or two. The sores will then ooze a fluid that contains the virus, and after a few days, the sores will later on form crust or scabs. The virus is, however, very contagious and can be spread by skin-to-skin contact, such as kissing. As for the symptoms, it is initial redness, swelling, heat, and pain or itching at the affected area. And the lesions are very painful, and fluid-filled blisters may be noticeable on the lips or under the nose. And these blisters leak fluids and later become sores. As for the treatment, antiviral medicines can be prescribed. It can either be topical creams or oral medicines. Next, we have immune-mediated diseases. So, three diseases are tabulated as below, which are oral lichen planus, OLP, erythema multiforme, EM, and Behçet's disease. As for oral lichen planus, it is a chronic inflammatory condition that usually affects the oral mucous membranes. As for erythema multiforme, it is initiated by either the deposition of immune complexes in the superficial of the skin and the oral mucous membrane, or it can also be cell-mediated. As for Behçet's disease, it is a rare chronic autoimmune disease that affects all body systems due to inflammatory effects of the arteries and the veins. As for the common sites of each diseases, they happen to be found at the tongue area and the buccal mucosa. For the etiology for OLP is genetics, autoimmune disease, drugs, as well as stress. As for EM, erythema multiforme, it can be from infections, drugs such as NSAIDs, radiation therapy, and food preservatives such as benzoic acid. Last would be Behçet's disease. It can be due to genetics and environmental. Next, we have the clinical features for each diseases. For oral lichen planus, it can be categorized into various types. The usual ones would be the reticular and the plaque type. The reticular type can be seen as interlacing white lines or striae. As for the plaque type, it is a keratotic raised area which appears as white plaques. The picture below is an example of plaque type OLP. Next is EM, which is erythema multiforme. It can be seen as multiple painful shallow ulcers and erosions with irregular margins. For early lesions, the lesions are macular, erythematous, and bullous, as seen in the picture below. The last is Behçet's disease, where the characteristics are oral ulcers, genital ulcers, and eye inflammation. So the picture displays an ulcer on the lateral side of the tongue.
Oral potentially malignant disorder. Here we can see there is a two table, which is leukoplakia and oral submucosal fibrosis, or SMF. In the table for leukoplakia, it said that leukoplakia is a white plaque occurring on any mucosal surface that cannot be wiped off and does not represent specific disease. The common site for leukoplakia is the lateral border of the tongue, floor of the mouth, and the buccal mucosa. Basically, the etiology for the leukoplakia is at smoking, alcohol consumption, microorganisms such as Candida and HPV. For the oral submucous fibrosis, is an oral precancerous condition that characterized by inflammation and progressive fibrosis of the submucosal tissue, resulting in marked rigidity and trismus. The common site for the oral submucosal fibrosis is soft palate, dorsal tongue, and lips. Basically, the etiology for oral submucosal fibrosis is recurrent that can cause increase in collagen synthesis and reduce collagen degradation. For the next slide here, we can see that the leukoplakia, which is clinical feature, we can see that is a uniformly flat, thin white plaque or patch, and a smooth surface sharply demarcated, exhibits shallows, fissure, and cracks. As example, which in this picture we can see of this clinical feature. For the oral submucosal fibrosis, in the picture is area of blanching And stiffness of oral mucosa basically is cover all oral mucosa, and it will limit opening of mouth, that we will suspect TMJ problem. And we can see also the presence of fibrous band in lips cheek of cephalate because of the arecanate that cause increase in collagen synthesis and reduce the collagen degradations. Next is a disease caused by human papillomavirus. In this table, we can see there is two tables, which is squamous cell papilloma and verruca vulgaris. In the squamous cell papilloma, there is a small benign growth that begins in squamous cell, generally diagnosed in people between the age of 13 and 15 from HPV strain 6 and 11. The clinical feature here, we can see the patient having a paleness, and we can see the soft peduncle patch with numerous finger-like projection, like as example in this picture. While for verruca vulgaris, the common is basically common white such as what can develop anywhere on the skin and frequently appear on the cuticle. Basically, if from HPV2 and 4, the clinical feature here we can see the painless papule or nodule rich papillary projection or a rough pebble surface. The frequently basically it appear on the cuticle. Next is a focal epithelial hyperplasia, which is or heart disease, which is a very rare viral infection, usually on the lower labial mucosa or rarely on the tongue, and these lesions are linked to HPV 13 and 32. The clinical feature here, we can see there are multiple flat top or dome shaped pink-white papules, which is asymptomatic, a multiple lesion of the less than 1 centimeter in diameter. Condyloma acuminata, basically a genital warts, which is these lesions are very basically found in the genital area, but can spread to the tongue. Basically, is due to the sexual contact, and it associated with HPV 2, 6, and 11. The clinical feature is asymptomatic, although they may occasionally cause bleeding, pruritus, and pain. The story of this multiple lesion is rather than one isolated wart, which is very common.
For a second case report, which related with localized tongue disorder with title Geographic Tongue, a case report with review of literature, a 4-year-old girl reported to the Department of Pediatric and Preventive Dentistry with chief complaint pain on lower left side, and the pain was severe and continuous, which radiated towards head and was aggravated on eating food and relief on taking medication. Based on intraoral examination, both right and left mandibular secondary pseudomolars are carriers, and the working diagnosis is reversible pulpitis. Periapical radiograph was also taken. Further oral examination was done, and the patient was diagnosed with geographic tongue, and the patient was not aware of it, and there is no related medical history. From the diagram, we can see that there are multiple erythema patches with slightly elevated thin yellow and well-demarcated borders that surround the patches. However, there are no abnormalities were diagnosed during further investigation, and the patient was advised for consumption of multivitamins, syrup, and motivated for proper cleaning of tongue with tongue cleaner for symptomatic relief. After 15 days, the tongue was clear and having faded pink hue surface with elevated red papilla, and the parents were also examined for the similar lesion, but no such lesion were found. Okay, now I will continue with localized tongue disorder. The first one is microglossia, which defined as abnormally small tongue, and microglossia mostly reported cases have been associated with one of the group overlapping condition, which is known as oromandibular limb hypogenesis syndrome. This syndrome is a group of dysmorphic complexes which characterized by the association of severe asymmetric limb defect and abnormalities of oral cavity and mandible. And the features of this syndrome are, the first one is hypodactylia, which is having fewer than the normal complement of fingers or toes. The second one is hypomelia, which is the incomplete development of tissue or organ. And if there is entire tongue is missing, it is called as aglossia. And frequently, microglossia is associated with hypoplasia of the mandible. So, from the diagram, we can see from the picture A
There is abnormally small tongue, which associated with constricted mandibular arch. And on the picture B, on the same patient, we can see there is constricted maxillary arch. The second one is macroglossia. It is uncommon condition characterized by abnormal enlargement of tongue. The enlargement can be caused by congenital malformations or acquired diseases. If it is caused by congenital malformation, it can be due to lymphangioma, hemangioma, cretinism, Down syndrome, and etc. And if it is caused by acquired diseases, it can be due to edentalospation, amyloidosis, myxedema, acromegaly, carcinoma, and other tumors. The clinical features of macroglossia are lisping speech, crenated lateral border of the tongue, open bite, and mandibular prognatism. If the macroglossia is severe, it can cause airway obstruction.
Hairy tongue is a condition where there is elongation of filiform papillae, which form a thick fur on the dorsum surface of the tongue. The elongation may up to 1 cm in length. It is common among heavy smokers and in some patients with antibiotic therapy. This is because the antibiotics disturb the normal flora of the oral cavity that results in overgrowth of this pigmented species. Even though it is asymptomatic, it may also induce gagging and nausea because the long papillae can give tickling sensation to the soft palate. The management would be tongue scraping. Next is varicosities, which are an abnormal dilated and tortuous vein. This condition is common in elderly and is age-related degeneration, in which there will be loss of connective tissue supporting the vessels. Sublingual type appears as multiple bluish-purple, elevated veins on the ventral surface of the tongue. Another condition is geographic tongue, also known as benign migratory glossitis. It shows map-like appearance on dorsum of the tongue. In detail, there is irregular, smooth, and red areas appearance, which rise from the loss of filiform papillae, while fungiform papillae remain as shiny dark eminence. A thin white line or band is the outline margin of the lesion. It begins with small lesion at particular area, which gradually enlarge, heal, and then reappear at another location of the tongue. This condition is usually asymptomatic but may also cause some irritation when associated with acidic and spicy food. The images are showing clinical and histological appearance of geographic tongue. The histological appearance include acanthotic with neutrophil infiltration throughout epithelium and lamina propria at the edge of the lesion. Other than that, there is lingual thyroid. Normally, thyroid bud descend into its final resting position, which is anterior to trachea by 7th week. However, if this does not happen, ectopic thyroid tissue may be found between foramen cecum and epiglottis. So, lingual thyroid is a condition where there is a mass of ectopic thyroid tissue located at the base of the tongue. This is caused by developmental anomaly of thyroid gland. It ranges from small asymptomatic nodular lesion to large masses that can block the airway. And the clinical symptoms include dysphagia, dysphonia, and dyspnea. Next is the most common oral mucosal condition, which is minor recurrent after stomatitis. The etiopathogenesis include 3 phases. In pre-ulcerative phase, there will be lymphocytic cell infiltrate the epithelium. This will cause focal vacuolation, followed by degeneration of suprabasal epithelial cell. This will lead to extensive edema and degeneration of epithelium and progress to ulceration. Second is ulcerative phase. There is increased infiltration of epithelium, while in healing phase, there will be regeneration of epithelium happens. The size is commonly less than 1 cm and the appearance is oval shape with ulcer base has grey, yellow, and red slightly raised margin. It is usually painful with duration of ulceration of few days up to 2 weeks. It heals without scar within 3 to 4 weeks. Last but not least is fissured tongue or scrotal tongue. It is the presence of numerous grooves of fissure on the dorsal tongue. Its clinical features are first, it has wide variation which include central groove with smaller fissure branching outward or numerous fissures that cover entire dorsal, separating it into multiple islands. Second, it is asymptomatic or only mild burning or mouth odors. Third, it may be associated with Malkersen-Rosenthal syndrome. Here are the list of references used for the slide preparation and further reading. Thank you.